totem pole, remind you, if you are interested in all the intricate, specific pieces of valuable information that go along with each system and how to assess this, it is in our IMS Level 4 class that you would learn the enormous amount of amazing information to help assess and correct an individual with dysfunctions. So mastication is next. It is the temporomandibular joint. It is the jaw. And not only talking about the physical nature and mechanics of this jaw, but we're also talking about what we put in this jaw, which is important. So anything that threatens your ability to, yes, eat my food, for sure. To masticate is a threat to life itself. So we have charts that we use that show these beautiful reflexive pathways to the teeth from the organs and glands. And if you have a periodontal issue, it will reflect into specific organs, cause issues, and specific musculoskeletal pathways. This is because each tooth has many periodontal ligaments that are highly innervated and send those messages to these pathways in the body. Can what you create or eat also affect it? For sure. So if you have an intolerance or an allergy to milk and you take in through your mouth milk, it can definitely take the neck system up and create dysfunction. I'm sure many of you have experienced it. If you have an intolerance, as soon as you drink milk and it doesn't agree with you, you get super phlegmy throat, or for that matter, it doesn't have to be milk, but you can also get a stuffy nose, which what happens then? For the body to create its balance and its physiology, and you can't breathe through your nose, you're going to automatically then breathe through your mouth, which causes a sympathetic reaction. Your respiration rate goes up because breathing through your mouth is parasympathetic. Through your nose is parasympathetic. So we assess the bite. Our teeth have facets that when our bite comes together, they lock in with one click. But if your bite locks in and you have 2 clicks, which would essentially be a slide and a click, then that's called eccentric occlusion. And a great example of this, and I just did this a couple weeks ago, I was chewing some needed wild meat, and I had my head turned. And if you turn your head, your jaw goes out of its alignment, and I ended up taking a big chunk out of my cheek because of the factor of alignment. So the bite is essential for strength and stability within the body. So eccentric occlusion is a threat. It wears down your teeth. Another threat to the system would be if you were to chew more on one side, say, because you have some sort of oral issues with your teeth and you're getting surgeries, or you've got abscesses or cavities or what have you. That chewing on one side, if we open our mouth 4,000 times a day and you're doing the chewing on one side, it can tighten up the neck muscles on that one side, which can cause an upper cervical subluxation that can essentially throw off the rest of the body or the rest of the systems below that, and compensation occurs. All right, so here we have a case history, and we're going to call this guy Mr. Banker because, well, Mr. B, Banker, he's a banker. But this particular guy had a developmental disorder, and we call this developmental order a crossbite. And if you're not familiar with what that means, it's when the lower incisors of the jaw are forward to the upper incisors, and basically throws off everything from the jaw, the cranium, the upper cervical, the lumbar, the pelvis, and essentially causes pain. This particular Mr. Banker had severe headaches since he was 6 years old, all from this developmental order with disorder within the jaw. And then through the activity and the compensations that occurred from this crossbite, ended up having lower back and upper cervical pain, which from 6 years old having severe headaches, the compensation of all the drugs that he had to take and the liver and the kidney essentially kind of tiring out from toxic overload. When really in the beginning, if they would have found this out and sent him to an oral facial surgeon, he would have never had any of those issues. So this person came in for upper cervical back pain and neck pain and headaches, but the root of it was his jaw. So most people would immediately start right into the lower back and trying to fix that, or immediately go into massaging the neck and reducing the tension, and more than likely not assessing the jaw to see if it was the mechanics of the disorder of the crossbite that was the ultimate root cause. So if you'll see here on the plumb line, which is something that we would do with this guy, you can see all the distortions that show up on this plumb line. So he has a weight shift. You could see his ears are completely off. He is compensating and losing his orthopedic alignment. From the lateral version of the plumb line, he's got that pelvic projection, which means his hips have slid forward. With the upper cross and with the lower, he has a Laird syndrome. And it's Vladimir Janda that said that when a person gets to a Laird syndrome, the dysfunction is so deeply rooted into the system, it is in most cases unrepairable. I think anything's possible, so I would definitely have a try it and have a vengeance to try to correct, but that's me. So when we've got these Laird syndrome issues, we have a wave of inhibition and excitation. So with this particular Mr. B or Mr. Banker, we have excitation of the suboccipitals, and then the excitation with the eyes trying to be level with the horizon. We have inhibition of the long cervical extensors, and then we would counter that with excitations going down with the thoracic lumbar, which then we would have inhibition of the lumbosacral, and then we would counter that going down further on the body with excitation of the hamstrings, and then we would further down the body have inhibition with the gastrocnemius. So it's excitation, inhibition, excitation, inhibition. And what's really important to also, once you gather that piece of information, then you also know that what goes hand in hand with that is hypermobility with hypomobility. And so inhibition is hypermobility, and hypomobility is joint tension and locking up. And where the system will eventually break down will be very much activity dependent. And obviously, as a banker and manager, he sits in a chair and analyzes paperwork and works on his computer. So his breakdown was in the neck and the back. Let's talk a little bit about why it's important to look at the eyes and the function of the eyes as it relates to the ocular system. So there's two types of essential for musculoskeletal health, and that is the focal vision type, which is character recognition and target acquisition. What does that mean? So what color is my team? And the next one represented is the ambient vision, which is proprioception, compensates for proprioceptive deficiencies. So ambient, if there's an injury to the spine, the hip, the knee, the neck, the low back, i.e. upper cervical dysfunction, the body will use vision to bring the eyes level with the horizon, which will cause a subluxation, and that you cannot correct yourself. So if someone has better vision in one eye, so they tend to rotate their head to see out of the better eye, that causes an upper cervical subluxation. So what I'm saying to you is, see how the eyes can cause distortions of the systems down below by those two things. So compensation comes at an energetic cost, and it's constant stress in the body. And we see this when someone is in pain. Another example of vision, if someone is nearsighted and they're trying to get closer, or they're subconsciously don't even realize when they're looking at their computer, their head migrates forward to actually see the letters on the computer, which ultimately follows suit of a kyphosis and then lumbopelvic issues as we follow the Levitt-Brother reactor system. Some great researchers here that found some interesting information for us. Lloyd Mills, an ophthalmologist, and C.L. Lohman, an orthopedist, noticed the connection between posture and ocular dysfunction all the way back in 1915. Gross ocular muscle defects and irregular astigmatism of notable degree occurred in proportion of 3:1, and we'll talk about that in a second. As far back as 1916, Weeks was quoted as believing that the habit of tilting the head to one side is very common and occurring in 25% of the patients who consulted him for errors of refraction of the extrinsic ocular muscles. So they had this idea there was orthopedic issues with an ocular dysfunction, and then they began studying together, and their research basically proved true. For every 3 that appeared to have an orthopedic injury or symptoms, 1 of them truly had an ocular dysfunction. So, and then lastly, to summarize and paraphrase what it's saying, people that had a subluxation, a tilt, when their head tilts to the side, that's a tilt subluxation of the atlas. 25% of those people had eye imbalances that caused that subluxation. Let's move on to the next system, the vestibular system, balance essentially. So this is a neurological marriage. When we talk about the vestibular, we're also talking about ocular and upper cervical. All 3 of them married together, kind of work hand in hand. It's the home of the tonic reflexes, equilibrium, and righting reflexes, which are all necessary to keeping you upright in the field of gravity. If there isn't synergy between these 3 systems, then the information is confusing to the neck, equilibrium, and righting reflexes. Anyone experiencing back pain will have some sort of issue to one or more of the systems. So if they have if there's a back pain patient, different systems will be needed to address to figure out what the source of that back pain or what the impetus to that back pain truly was. And so let's talk about how the 3 systems, the married systems of vestibular, ocular, and upper cervical, can contribute to overall back pain. So because of the importance of these 3 systems, we've connected that the issue of training and activating these systems in the gym is super effective by using balance type exercises, i.e. for the vestibular activation system. So it requires neuromuscular activation. It requires balance. So like we've said before, machines, you do not need any stabilization. It's fixed axis. There is no challenge to the neuromuscular system. It is a regression. So like we've said before, walking to your car is neurologically more challenging than doing this particular seated on a machine doing leg extensions. And this is why people that work out in the gym are always surprised when they go on the weekends and play with their kids, wash the car, do a flag football game, play golf, help someone move, and can't figure out why the next day they can't move. So when we talk about where our body and head is in space, one of the things that the Swiss ball exercises does for us is it relates to spindle cell counts in the body. So when we look at the body, the higher in the body and more towards the midline, the spindle cell count increases. And the more spindle cells that you have in that particular area of the body, the more proprioceptive it is. So if you're doing a proprioceptive exercise, it helps challenge that ability to help the physical body more understand and know where the body is in relationship to everything else, because you've challenged it in the gym. And when you're using exercises that use Swiss balls, then you're working the core, and you're working the parts of the body that have the highest number of spindle cells. Cranial cervical system, highly integrated with ocular, vestibular, pelvic, foot, and ankle proprioceptive systems. Origin, the tonic reflexes. The suboccipital spindle cell count is 150 to 200. Okay, so as we move down to the intertransversaries muscles, we've got 200 to 500. So when we're working with the upper cervical, that's why it's really important when we're doing stretches for the upper cervical, I say head and neck area, do not do high, long rep holds, 1 to 2 reps of 3 to 5 seconds, only because of the magnitude of proprioceptive in these muscles due to the spindle cells. It can cause you grave pain the next day by doing too strong of a stretch. In other words, it needs to be light intensity, about a 40%, and it needs to be short holds. Okay, so the suboccipitals, the spinales, intertransversaries tell you where your body is. The spindle count increases, like we've said, the higher we go, which, in other words, to give you an example to illustrate that, the levator scapula, it would be more proprioceptive than the bicep muscle or the tricep. So we would train and utilize the core with its greatest capacity to help the body understand on its own where it is. And if you've ever had anybody do an exercise that teaches this extremely well, it would be to take a Swiss ball, and I call it Superman, which was no hands and no legs, touching the ground and balancing from the center of the body on the Swiss ball with the arms and legs horizontal to the floor. That is a really good example of this type of training that we're talking about as far as proprioceptive and understanding that. Because you're able to relax, first of all, and then find your center. Okay, so Kara Levitt's research says that 70% of proprioception in gait comes from the cranial occipital to the cervical 3-4 segments. So when I say cranial occipital, that means the cranium, and then the C1 through C3, C4. Gait, the ability to basically walk upright in a field of gravity. So her research, and I'll read this first, she blocked the upper cervical proprioception in monkeys, resulting in falling during gait and climbing, which basically her research proved that cervical mechanoreceptors reflex to limbs and trunks. So let's talk about what she did. So they injected monkeys this blocking agent in their facet joints and all the joints in their body and they watched to see what happened. And, basically, the monkeys performed normally, climbing trees, swinging with limb to limb across trees, doing their normal thing. And then once they got to injecting C3-4 and higher in the monkeys, essentially the monkeys acted like they were drunk and they could not coordinate their movements. They would fall over, fall down, and have a really hard time climbing or doing anything using their riding reflexes. And so essentially it validates that the cervical mechanoreceptors refer to the limbs and orchestrate movement. So the craniocervical control, the most commonly subluxed vertebrae in the body is the atlas, is essentially, if we take our cranium and one vertebrae, the first vertebrae underneath the cranium is the atlas. It is the most mobile vertebrae with the least amount of muscular tension of all the vertebrae in the body. It has the greatest influence over the nervous system. When the atlas subluxes, and there's 4 distortions within the subluxation of an atlas. You have a tilt, a rotation, a shear, and a projection. So one of the ways that we can actually test the magnitude of a rotation within an atlas is using bilateral scales that we used in the respiratory assessment. But everything below the atlas then distorts essentially to keep the eyes level with the horizon. The pelvis will be off, the lumbar, the thoracic, the cranium, all leads to musculoskeletal excitation and inhibition. Because we have one important nerve called the vagus nerve that essentially passes through this vertebrae, the symptoms are largely unexpected and oftentimes, I mean a lot, are undiagnosed because, in my opinion, the atlas doesn't get near the respect that it should. So with that being said, with this impingement of the vagus nerve, you can see menstrual irregularities, you can see high blood pressure, you can see tiredness, you can see dizziness, you can see insomnia, you can see digestive issues, visceral pathology, constipation, dysregulation of the autonomic nervous system, and heart palpitations. It is mind-blowing. But once the atlas is balanced, then the person will feel a tremendous difference in that they'll have upper cervical balance, good alignment, rotational efficiencies, good engrams, and obviously pain-free, which we love. So how to integrate the corrections and refacilitate these good patterns? So we choose exercises that refacilitate that, and that is proprioceptive exercises that require balance. And that I don't mean the leg press on the left. That does not require balance. That's not a balance challenge exercise that will stimulate your stabilizers. Would only, as we've talked about, hinder it. So in order to get optimal vestibular reflexes and the craniocervical integration, exercises need to match the activity of the person's environment. So windsurfing requires basically a tilting reflex profile with a Swiss ball, obviously we could use. Otherwise, there isn't much carryover. The guy in the slide that's working on a basic construction site, he would probably not benefit from neuromuscular Swiss ball exercises. He would benefit more from doing riding reflexes. Like, for instance, the carryover in the slide shows a single arm cable press with integration. And that would be a prepare and make him strong on the job.